And in this evening's health report, Shemala Pullen looks at pilonidal disease.
Pilonidal disease is a condition where hair gets trapped under the skin near the top of the buttocks, close to the tailbone.
It is common mainly in the teenage years and generally between, say, 15 up to, say, age 30 and young adults. So our teenagers are particularly at risk and young adults. Important risk factors would be patients that are particularly hairy, or the hair itself is very stiff or brittle, and also patients that are obese or have to sit for long periods of time. Typically, this hair is found in the tailbone area, that is at the lower end of the spine. And you can imagine that the patient may be sitting for a long time or the hair itself is very stiff.
Globally, it affects approximately 70,000 people per year, most commonly in individuals aged 15 to 30 years. However, no specific data is available for Jamaica. It can also lead to complications such as...
Over time, you may get the hair going into the deeper layers of the skin, which then becomes infected, and this is why the symptoms occur. They may become infected, leading to drainage from the back, the lower tailbone area, or you may see evidence of an abscess where the area is very tender, painful, red, and it tends to be a recurring problem. So the patient may go to the doctor and gets antibiotics, it settles, and then it keeps becoming, it's a recurring issue. And general examination, that area of the tailbone is pathognomonic. That is typically where we're going to find it. And invariably that area you may see like a little sinus.
Treatment can be surgical, non-surgical, or laser-based.
As a surgeon, we want to treat patients without or with limited liabilities or the risk of these problems coming back. Of the problems we deal with in teenagers and young patients, unfortunately, the recurrence rate, having removed or surgically removed a pilonidal sinus, is pretty high in comparison to some other procedures that we do in children. Now, the need for surgery is once they become symptomatic.
With our health report, I'm Shemala Pullen, wishing you good health.